Kani kadai ka Batisi TV, bat pidang pet ya ka kubor baman kasni, belawan rasha pi da ka rupa, ringkat bat ka orange Nissan, lom sopo near Fire Brigade Shillong.
New Nissan Kicks. Bookings open now.
Myntri Rangbah ke Jelau, Konrad Cscmi, hakakat waiterik unailur arajar khat kendai, ula Plie Paidbah, ya ka Center for the Study of Complex Malaria in India, Malaria Research Laboratory, Badia ka Master of Public Health Program, Haga Jaka Trekam Joga Indian Institute of Public Health, Kabadon Hanong Ba Shillong. Haga Jingelang, Laidon Langru Myntri Ketenat, Jonga Koit Kakhya, Jonga Sorkar Jela Uba Alexander L. Heck. Kumban Shukudau Hangni ka Center for the Study of Complex Malaria in India, Kashnat Trekam Jonga US National Institute of Health funded International Center of Excellence in Malaria Research, Daga Jinge Trelang, Hapdenki researcher Jonga New York University, Bargi scientists Kuntupru Yaki clinicians Hagari India, Hapo ka Jingpet Jingkmi Jonga Professor Jane Carlton.
I'm pleased to hear that the first batch of 2019 has 16 doctors, nurses, and allied health professionals from Meghalaya and the northeastern regions. And I'm pleased to hear that this is the first of its kind course being offered in the northeast regions. I'm sure that those who pass out will help us in strengthening and improving our health system, especially keeping in mind the National Health Policy 2017. The combinations of the creating public health care for the nations. I'm also very happy to hear about the malaria research at the Center for the Study of Complex Malaria in India, Cscmi at IIPH. It's very good to hear of the many collaboration with the New York University, USA and other major institutions from abroad and India. I'm pleased that the Meghalaya has been selected as a place for one of the 11 International Center of Excellence in Malaria Research initiative of the National Institute of Health, USA. We thank the National Institute of Health, Government of USA for establishing this research laboratory here. I am especially happy to hear that the team is training and supporting the young researchers and health professionals and our states and region to become a better researchers. Please continue to work with our malaria department of the DHS and support our initiative to eradicate malaria in the next few years. I'd like to share also with all of you about the present scenario of the malaria in our states. It has sharply declining. See, the overall declining of the malaria in our states has come down to 76.02%. See, the deaths right from 2015 to 16, 17 and 18 till the July 2019 we have only one death in malaria. So that's why it shows that how much is declining, sharp declining of the malaria in our state because of the efforts and hard working of all the staff of the health department and particularly the malaria workers.
As you all know, friends, everything is changing. The environment is changing. We have a lot of change in the overall weather patterns. We are seeing more floods, we are seeing more rains, we are seeing more tropical climate coming in. Obviously that means we will see more vector-borne diseases coming in. These are areas of concern and something that I think this research institute which is here will slowly, I'm sure, and as we go along, will expand. It's a natural expansion from malaria to go into other vector-borne diseases. And you must have seen in the last few days, many states and many regions have been facing a lot of problem with JE and other forms of vector-borne diseases. So therefore, I think it's a matter of concern. And what I would like to see is that the research that is being done looks at the patterns that are emerging now. As I said, malaria is one pattern which is, we can see some dip in it, but obviously it's important to keep track of things. But it's very important to also see what we could be possibly looking at in the next many years. And I think that is where the public health, the masters in public health comes in. Again, as I said, I'm not very, detailed in all these aspects. But I think, as was mentioned, I was just looking at a few of the points being mentioned out there, that you will be actually looking at trends and data and looking at how, what kind of areas of concern there could be when it comes to actually predicting in the future outbreaks and all these areas. And I think it's a great initiative that has been taken. And of course, a lot of people know that the government that we are running right now, the policies that we are making right now, a lot of stress is being given to data. And we strongly feel that if we do not have the correct data, then we will automatically end up making the wrong policies and the wrong decisions. So data-driven governance is something that's a top priority for us. We don't do anything now, as far as possible, without having the facts and the data and the trends that is there with us. Just to give you an example, of a data-driven project which we are now expanding to the entire state, is a project which we took up for institutional deliveries. And you'll be happy to know that in the last 6 months, we took up one district. Our institutional deliveries have been very low. Our maternal mortality rate is almost touching 200, which is very high compared to the national average of about 135. So therefore, we took it up to ourselves. We ensured that we started tracking the mothers. So what we did, we took one district, we tracked all the pregnant mothers, and we geomapped them, so we geotagged them, So basically, on a mobile phone, at any given time, we actually knew how many mothers were pregnant in every village. And that allowed us to also predict, obviously, very easily, when they were expecting. And that allowed the officials, the drivers of the ambulance, to ensure that the pickups were organized for them so that they could come to the institutions and deliver. So in this particular district, we saw that before the program started, we had 40% institutional deliveries. But after this program, this data-driven program was done by us, the institutional deliveries have gone up to 80%. So we have doubled them. And we intend to expand this program throughout the state. And we hope that we'll be able to achieve 80% of institutional deliveries throughout the state, maybe in about 6 months or 1 year, or at least in the next financial year. We hope that will happen. And what is also important for us, and I don't know how maybe the public health master's program out here can play a role in that with us, is that we plan to extend this beyond that. So tomorrow what we're coming out is we're coming up with a program that is going to actually map the mothers and the children for the next 5 years to 10 years. So this is going to be a platform that is going to actually keep a data on every child that is born, the vaccination programs that the child is going to have, geotag them each, ensure that the nutrition programs that are being done by social welfare department also are connected to this, so that when the ASHA worker is actually going and checking out the child, he or she will know that yes, to the Anganwadi worker and to the social welfare department, this child has received the nutritional programs that they have. And similarly, the Anganwadi worker should know that the ASHA worker or the particular doctor has, or the medical officer has given the immunization that the child needs. Sometimes there is a disconnect between the two. And we see, and I felt that sometimes departments are so involved in their numbers and in their targets that they actually end up forgetting the purpose of what they're doing. And we must always remember that our purpose is a healthy mother and a healthy child. And in the process of ensuring that so many vaccinations should take place, so many tablets should be distributed, so many kgs of this nutrition should be given, we actually forget to see whether the child actually health is improving or not. So the entire process of having this data-driven process and ensuring that all these indicators come on the same platform, and we'll be having in fact an app for this. And from the CM dashboard, we'll be actually monitoring. I will be monitoring all of this. So actually, I'll be monitoring, and we'll be able to see the trend of immunization for the whole state in one shot. So I will know exactly at any given time how many children are there who are between the age of 1 and 2, and how many of them have received the necessary immunization, if there is to be given to those children. So it will allow me to ensure that I have made the right decision. I think these are the kind of things which are very, very important for government to improve its efficiency and delivery system. And I think that programs like these will surely help the government also to make a better decision.